I'm from a family of nurses, and that always inspired me growing up. I went to college at Gallaudet University and I got a history degree, and I just felt like it didn't really, satisfy me in my life. I wanted more than that. I met a deaf lady who was 96 years old, and she had fired all of her hearing nurses. So her daughter was like, please help me. So I was willing to help, and I did that for 2 summers. I took care of her, fed her, helped her shower, kept her company. And I really realized that I enjoyed that job. The deaf community has always had a difficult relationship with healthcare. There's a lack of communication access, there's a fear of discrimination, there's a lot of misunderstanding between the 2 languages. And that really inspired me to help other deaf people understand what their health needs are and what what medical professionals we can try and teach to make sure that they know what to do, what things they need to take, and they can kind of build that bridge. I can build that bridge between the deaf community and healthcare. I probably interviewed a total about 16 times all over Jacksonville. I interviewed and I did everything right. Like I said, I got licensed. I became very frustrated and disappointed, and I thinking that I did everything right, and people were still doubting me, and people were still writing me off and oppressing me, and I was angry about it, but at the same time I knew that someone out there was going to give me a chance, and that was Memorial Hospital.
Working for HCA gave Bebe this chance to be this fantastic ER nurse that she is, and there were times that it was a struggle with contracting services, with getting the interpreters here, make sure their schedule aligns with Bebe's schedule, that they can work the same shifts. To include education, she has to do classes, she has to do, she has to get other certifications. Her interpreters have to be there for her too. And I'm so proud to work for a company that, like HCA, that supports all of this movement and making sure that she's offered the same opportunities as everyone else.
I'll never forget, I say, hi, my name's Bebe, I'm a deaf nurse here, and their face is it just makes my day, because their jaw drops and they go, oh my gosh, you're deaf, and then they tell me everything. And with that, I can explain it to the doctor, and so I'm able to help facilitate what exactly the doctor's looking for from the patient. And so that's really nice for me to make sure that I'm there to facilitate that and create a better relationship between them.
Her being deaf has helped tremendously in multiple situations where we've had deaf patients. It really helps having someone there who can immediately have that communication. We've also had patients that were, very fearful about what was happening, and her being there and being a calm presence, and she has so much empathy and she connects with anyone, but I would say especially the deaf patients have appreciated having someone that really, can relate with them on a different level.
For those deaf students or hard of hearing students who really want to become involved in the healthcare field or profession, I have a message for you. Ignore all those people that tell you can't and prove them wrong, because you can do this and you can follow your dreams.